Have you ever found yourself thinking about something most men quietly wonder about but almost never discuss openly? Something simple on the surface, yet deeply tied to energy, focus, relationships, confidence, and even long-term health. What actually happens inside the body when a man ejaculates every single day? Is it something the body is designed to handle without consequences? Or does it slowly create changes that most people never connect to the habit itself? This is one of those questions that sits in the background of men's health for years. It rarely gets asked directly in a clinic, yet it shows up in different forms all the time. Men ask about fatigue, low motivation, reduced drive, performance anxiety, changes in sleep, or even a general sense that something feels different. And when you start connecting the dots, this topic often sits somewhere in the middle of the conversation. The truth is, this is not just about sexual activity. It is about neurochemistry, hormones, behavior patterns, emotional regulation, and how the brain and body adapt over time to repetition. And like most things in medicine, the answer is not extreme. It is not simply good or bad. It is context dependent, deeply individual, and shaped by intention, frequency, age, and overall lifestyle. Let us slow this down and look at it the way a clinician would, not with judgment, but with clarity. Because once you remove shame and confusion, what remains is understanding. And understanding gives you control. First, we need to correct a very common misconception. The body does not assign moral value to ejaculation. It does not label it as healthy or unhealthy in isolation. Instead, it responds to patterns. It responds to frequency, recovery time, psychological context, and what else is happening in your life. A man who ejaculates daily while sleeping well, eating well, exercising, and maintaining emotional balance is in a very different physiological state compared to someone using the same behavior as an escape from stress, anxiety, loneliness, or lack of control. This is why blanket statements fail. Biology does not work in absolutes. It works in systems. Now, to understand what daily ejaculation does, we need to separate the experience into two sides. On one side, there are potential benefits that come from the neurochemical and physiological response. On the other side, there are possible drawbacks when the habit becomes excessive, compulsive, or disconnected from balance. Let us begin with what the body actually experiences in a healthy context. When ejaculation occurs, the brain enters a very specific neurochemical state. There is a release of dopamine, which is the neurotransmitter associated with motivation and reward. There is also a surge of endorphins, which reduce pain perception and create a sense of relaxation. Alongside this, oxytocin increases, which is linked to bonding, calmness, and emotional stability. Serotonin also plays a role, helping regulate mood and creating a sense of mental settling after arousal. From a biological perspective, this is not random. It is a coordinated reset of multiple systems. The nervous system shifts from a state of sympathetic activation, which is alertness and arousal, into parasympathetic dominance, which is rest and recovery. This is why many men report a sense of calm or even mild drowsiness afterward. In practical terms, this can help reduce stress, not eliminate it, but soften its intensity. For some individuals, especially those living in high-pressure environments, this temporary downshift in stress hormones can feel like a release valve. It can prevent emotional buildup and reduce irritability. However, it is important to understand that this is not a treatment for chronic stress. It is a temporary modulation of the nervous system. Another commonly reported effect is improved sleep. After ejaculation, prolactin levels rise. Prolactin is associated with satiety and relaxation, and in combination with reduced dopamine activity, it can create a state that favors sleep initiation. For men who struggle with racing thoughts at night, this hormonal shift can make it easier to transition into rest. But again, This is not a sleep medication. It is a physiological side effect of a neurochemical cascade. There is also a vascular component that is often overlooked. Sexual arousal and orgasm involve significant changes in blood flow. Blood vessels dilate, heart rate increases, and circulation becomes more dynamic. This is a short-term cardiovascular event that reflects endothelial responsiveness. In simple terms, it is a sign that the vascular system is capable of adapting quickly to demand. While this is not equivalent to exercise, it does engage similar physiological pathways involving nitric oxide and blood flow regulation. Now, one of the more discussed long-term associations in medical literature is related to prostate health. Large observational studies, including long-term cohorts, have found an association between more frequent ejaculation and a lower incidence of prostate-related disease later in life. One widely referenced study followed men over many years and observed that those with higher ejaculation frequency showed a reduced risk of prostate cancer diagnosis. The proposed explanation is not fully confirmed, but several mechanisms are suggested. One theory is that regular ejaculation may help clear prostatic secretions, reducing stagnation and inflammatory buildup. Another is that frequent fluid turnover may reduce exposure time to potentially harmful metabolic byproducts within the prostate environment. However, it must be stated clearly that this is an association, not a guarantee of protection. It does not replace screening, lifestyle management, or medical care. It simply suggests that the prostate is not a static organ. It is metabolically active and influenced by functional use. There is also an interesting immunological observation. After sexual activity and orgasm, transient increases in certain immune markers, such as immunoglobulin A, have been noted. This suggests a short-term modulation of immune activity, likely mediated through stress reduction and hormonal shifts. Again, this is subtle, not dramatic. It contributes to the broader picture of how interconnected sexual function is with overall physiology. So far, we have discussed the supportive side of the equation. But medicine is incomplete without also examining what happens when patterns become imbalanced. One of the first concerns is not physical damage, but behavioral conditioning. The brain is highly adaptable. Dopamine pathways in particular are sensitive to repetition. When a behavior is repeated frequently in a short reward cycle, the brain begins to prioritize that pathway as a quick source of relief or pleasure. Over time, this can shift behavior from intentional to automatic. And this is where the important distinction arises. There is a difference between choice and compulsion. If the behavior is chosen mindfully, it remains within healthy control. If it begins to feel necessary rather than optional, it may start influencing attention, productivity, and emotional regulation. This is not about moral judgment. It is about neuroplasticity. The brain learns what you repeatedly reinforce. Another issue that can arise is emotional substitution. Some men may unconsciously use sexual release as a primary coping mechanism for stress, boredom, or emotional discomfort. The immediate relief reinforces the cycle, but the underlying emotional need remains unaddressed. Over time, this can reduce the development of other coping strategies such as physical activity, social connection, structured relaxation, or emotional processing. In such cases, the behavior is not the problem itself. The limitation comes from exclusivity. When one pathway becomes the only outlet, resilience in other systems may weaken. There is also the consideration of reproductive physiology. Sperm production is continuous, but maturation and optimal concentration require time. With very frequent ejaculation, sperm count per ejaculate may decrease temporarily. For couples actively trying to conceive, timing and spacing can therefore play a role in optimizing fertility outcomes. Typically, a recovery window of 1 to 3 days allows for higher concentration. Another subtle but important point relates to sensitivity and sexual response. The nervous system adapts to patterns. If stimulation is consistently rapid, high intensity, or rushed, the body can begin to associate sexual release with a specific tempo. In some individuals, this may contribute to reduced sensitivity in partnered situations or changes in arousal patterns. This is not permanent damage, it is conditioning. And conditioning can be reversed with time, variation, and behavioral adjustment. Finally, there is the issue of performance perception. When sexual activity becomes mechanical or rushed, some individuals may experience increased anxiety during partnered intimacy. Not because of physical dysfunction, but because of learned expectations that do not match real-world interaction. This is where psychological factors begin to overlap with physiological response. At this point, we are seeing a complete picture emerge. Daily ejaculation is not inherently beneficial or harmful. It is a biological process layered with psychological meaning and behavioral impact. The same action can support relaxation in one context and reinforce imbalance in another. So the real question is not, is it good or bad? The real question is, what role is it playing in your life? Is it a conscious choice that fits within a balanced lifestyle? Or is it becoming a default response to stress, emotion, or habit? Is your energy stable? Your sleep improving? Your focus intact? Or are you noticing subtle changes in motivation, emotional clarity, or relational connection? These are the questions that matter more than frequency alone, because ultimately the human body is adaptable, it responds to patterns, not isolated events. And when you understand that, you stop looking for rigid rules and start developing awareness. In the next part of this discussion, we will go deeper into the less obvious psychological effects, the long-term behavioral risks that are often ignored, and how to build a balanced approach that supports energy, confidence, and long-term sexual health without extremes. For now, the key takeaway is simple. This is not a topic defined by fear or freedom alone. It is defined by awareness. Continuing from where we left off, it is important to go beyond surface-level benefits and drawbacks and examine what actually happens when this behavior becomes part of a long-term pattern in the brain and body. Because while the immediate effects of ejaculation are relatively well understood in terms of hormones and physiology, the long-term behavioral adaptations are where things become more nuanced and in some cases more important for men trying to optimize energy, focus, emotional stability, and sexual performance over decades rather than days. One of the most overlooked aspects of daily ejaculation is not the act itself, but the learning process that surrounds it. The human brain is fundamentally a prediction machine. It learns through repetition, association, and reward. Every time a behavior is repeated, especially one that produces a strong neurochemical response, the brain strengthens the neural pathways involved in that behavior. This is basic neuroplasticity. What gets used gets reinforced. Now, when ejaculation is part of a balanced sexual life, the brain associates it with intimacy, connection, relaxation, or natural desire. But when it becomes frequent, isolated, or used as a quick regulatory tool for stress or emotional discomfort, the brain can slowly begin to reclassify it as a rapid access reward system. This is where subtle shifts begin to occur, not in a dramatic or immediately obvious way, but gradually over time. Dopamine plays a central role here. Dopamine is not the molecule of pleasure itself, but rather the molecule of anticipation and motivation. It drives you toward behaviors that the brain has identified as rewarding. When a behavior like ejaculation is repeated frequently, especially in short intervals, the dopamine system can begin to recalibrate. The baseline expectation of stimulation may shift. In simple terms, the brain starts to expect higher or more frequent stimulation to achieve the same level of satisfaction. This does not mean damage. It means adaptation. And adaptation can be either beneficial or limiting depending on context. In some men, this adaptation presents as reduced motivation in other areas of life. Activities that require delayed gratification, such as work, exercise, studying, or building relationships, may feel less stimulating in comparison. Not because those activities have changed, but because the reward system has become tuned to a faster cycle of stimulation and release. At the same time, another layer must be considered, which is emotional conditioning. When a behavior becomes a primary coping mechanism, the brain begins to link emotional states with that behavior. For example, stress leads to release, boredom leads to release, loneliness leads to release. Over time, this can create a pattern where emotional discomfort is not processed, but rather bypassed. The problem here is not ejaculation itself. The problem is the absence of alternative emotional tools. The human nervous system is designed to experience a full range of emotional states and then return to baseline through multiple pathways: movement, connection, reflection, rest, and yes, sometimes sexual release. But when one pathway dominates, the system becomes less flexible. Flexibility is a key marker of resilience. A flexible nervous system can handle stress without becoming dependent on a single relief mechanism. A rigid system, on the other hand, may rely heavily on one behavior for regulation. This is where imbalance can slowly develop. Now, let us address something that is often misunderstood in this conversation. Sexual desire itself, libido, is not a fixed trait. It is a dynamic output of multiple systems, including hormones, sleep quality, stress levels, relationship satisfaction, metabolic health, and neurological sensitivity. When ejaculation becomes very frequent, especially without variation or periods of abstinence, some men report changes in desire patterns. This can manifest in two opposite ways. In some cases, desire may decrease slightly due to reduced novelty and reduced dopamine response intensity. In other cases, desire may become more stimulus dependent, meaning arousal becomes more linked to specific patterns or contexts rather than spontaneous interest. Both of these are examples of neural adaptation, not pathology. It is also important to highlight the role of recovery. The body is not designed for constant peak activity in any system. Muscle tissue requires rest after exercise. The cardiovascular system requires recovery after stress. Similarly, the neuroendocrine system benefits from cycles of activation and rest. Daily ejaculation does not inherently violate this principle, but it does reduce the interval between activation cycles. For many men, this is completely sustainable. But for others, especially those with high stress loads, poor sleep, or low metabolic reserve, it may contribute to a sense of reduced internal energy over time. Energy, in a physiological sense, is not just about calories. It is about nervous system efficiency, hormonal balance, mitochondrial function, and psychological load. When men report feeling drained, it is rarely one single cause. It is usually a combination of factors. But behavioral patterns, including sexual habits, can contribute either positively or negatively depending on how they fit into the broader lifestyle. Another dimension worth discussing is performance anxiety and sexual conditioning. The male sexual response cycle is highly responsive to learning. If sexual release is consistently associated with speed, privacy, or time pressure, the nervous system can begin to encode those conditions as part of the arousal pattern. Later, in partnered situations, where timing, emotional connection, and mutual pacing are different, some men may experience mismatch between expectation and response. This is not dysfunction in the classical sense. It is conditioning mismatch. And conditioning can be reshaped. Slowing down arousal patterns, varying stimulation, and reducing urgency can help retrain the nervous system toward more adaptive responses. This is why many sexual health specialists emphasize mindfulness and awareness rather than frequency alone. Now, stepping back, we need to integrate all of this into a larger framework. Because the real goal is not to label daily ejaculation as good or bad, but to understand where it sits within the hierarchy of health priorities. At the foundation of men's health are sleep, metabolic function, cardiovascular health, mental health, and social connection. Sexual function is deeply connected to all of these, but it is not isolated from them. If sleep is poor, libido changes. If stress is high, sexual behavior may shift. If cardiovascular health declines, erectile function may be affected. Everything is interconnected. This is why focusing on a single behavior without context can be misleading. A man may ejaculate daily and feel completely healthy because his sleep is strong, his stress is managed, his relationships are stable, and his body is metabolically balanced. Another man may ejaculate at the same frequency but experience fatigue, reduced focus, or emotional flattening because his baseline health is already under strain. So the question is not frequency alone. The question is integration. Now let us talk about something practical. How does a man know if his current pattern is aligned with his health or not? There are few clinical indicators that matter more than moral judgment or external rules. The first is energy stability. Not peak energy, but consistency across the day. If energy levels remain stable, that is a good sign. If there are noticeable dips in motivation or alertness that correlate with sexual behavior, that is worth observing. The second is emotional tone. After ejaculation, does the individual feel calm and balanced, or does he feel flat, unmotivated, or slightly disconnected? The difference between relaxation and emotional flattening is subtle but important. The third is sexual responsiveness in real-life contexts. Is desire naturally present in relationships, or is it dependent on specific triggers or habits? This helps assess whether conditioning is flexible or rigid. The fourth is control. This is perhaps the most important. Does the behavior feel chosen, or does it feel automatic? Agency is a key marker of psychological health. When a behavior is under conscious control, it integrates well into life. When it becomes automatic, it begins to shape life instead of serving it. The fifth is recovery capacity. Does the body feel restored after rest, or is there a sense of ongoing fatigue that does not fully resolve? While ejaculation is rarely the sole cause of fatigue, it can contribute when combined with other stresses. Now, it is essential to be very clear about one point. This entire discussion is not about promoting restriction or fear. It is about awareness and optimization. Sexual function is a normal, healthy, and important part of human biology. Suppressing it unnecessarily is not beneficial. At the same time, ignoring patterns that reduce quality of life is also not helpful. The goal is balance. From a medical perspective, the healthiest approach is one that aligns behavior with physiology, psychology, and life goals. That means allowing flexibility. Some phases of life may involve higher frequency. Other phases may naturally involve lower frequency. Stress, relationships, age, and health status all influence this. There is no universal number that defines optimal behavior. Any attempt to impose a fixed rule ignores biological individuality. What matters more is responsiveness. The ability to adjust based on feedback from your own body. That is the essence of physiological intelligence. If we zoom out even further, we can see that this conversation is not really about ejaculation at all. It is about self-regulation. It is about how humans manage internal states using available tools. Some tools are external, like exercise or social connection. Some are internal, like breath, attention, or sexual release. The healthiest individuals are not those who avoid certain tools, but those who understand when and how to use them appropriately. So the final insight is this. Daily ejaculation is not a problem to be solved. It is a variable to be understood. In the right context, it can support relaxation, sleep, and well-being. In another context, it can become a habitual pattern that reduces flexibility or masks underlying needs. The difference is not in the act itself. The difference is in awareness. And awareness is what ultimately determines whether a behavior strengthens your life or quietly limits it. In the final part of this series, we will bring everything together into a clear framework that helps you personalize your approach based on age, lifestyle, goals, and health status, so you can make decisions with clarity rather than confusion, and with confidence rather than doubt. In this final part, we are going to bring everything together into something practical, grounded, and usable in real life. Because understanding the biology and psychology is important, but what most men actually want is clarity, not theory, not extremes. Just a simple way to look at their own body and know whether what they are doing is helping them neutral or quietly working against them over time. So let's step back for a moment and stop focusing on ejaculation as an isolated act. Instead, we need to place it inside the larger system of a man's life, because no behavior exists in isolation. Everything is connected. Sleep, stress, hormones, relationships, age, fitness, and mental state. When one of these shifts, sexual function often reflects it before anything else does. This is why, in clinical practice, sexual health is often a mirror. It doesn't just show what is happening in the reproductive system. It reflects cardiovascular health, neurological balance, endocrine stability, and even emotional well-being. That is why changes in libido, performance, or satisfaction are often early signals rather than late symptoms. Now, if we want to make sense of daily ejaculation in a practical way, we need to divide men into different physiological and lifestyle contexts, because the same habit can have completely different meanings depending on the person. Let's start with younger men, typically late teens through early 30s. In this stage of life, testosterone levels are naturally higher, recovery capacity is stronger, and neuroplasticity is at its peak. For many in this group, daily ejaculation may not produce any noticeable negative effects if the overall lifestyle is balanced. In fact, for some, it may coexist with normal energy levels, stable mood, and healthy sexual function. But even in this group, the key variable is not age, it is pattern. A young man who is physically active, socially engaged, mentally stimulated, and emotionally balanced will respond very differently compared to someone who is sedentary, overstressed, sleep-deprived, and using sexual release as the primary source of reward or escape. So even in youth, the question is not, can the body handle it? The real question is, what role is it playing in the overall system? Now, let's move to middle age, typically 30s through 50s. This is where things become more sensitive. Not because the body is failing, but because baseline recovery begins to change. Stress accumulation becomes more relevant. Sleep quality often declines due to lifestyle demands. Work pressure, family responsibilities, and metabolic changes start to interact more visibly with hormonal balance. In this stage, daily ejaculation may still be completely normal for some men, but it becomes more important to observe recovery signals. Energy consistency, morning alertness, motivation levels, and sexual responsiveness in real-life situations all become important feedback markers. What often matters more in this age group is not frequency itself, but whether sexual behavior is supporting vitality or competing with it. If a man feels more relaxed, sleeps better, and remains mentally clear, then the behavior is likely integrated well. But if there is subtle fatigue, reduced drive, or a sense of emotional flattening, then it may be interacting with other stressors in a way that reduces overall resilience. Now, in older age, typically 55 and beyond, the discussion shifts again. Here, physiology naturally changes. Testosterone gradually declines. Vascular health becomes more important for sexual function, and recovery time increases. In this stage, sexual activity remains not only possible but beneficial in many ways, especially for cardiovascular health, emotional well-being, and quality of life. However, frequency becomes less relevant than quality and recovery. The nervous system in older age responds more strongly to rest and restoration. So daily ejaculation may feel completely fine for some individuals, while others may naturally shift to a lower frequency without any negative consequence. What becomes more important here is maintaining vascular health, emotional connection, and avoiding unnecessary stress around sexual performance. In this stage of life, sexual health is less about output and more about sustainability. Now, across all age groups, there is one principle that remains constant. And this is where most confusion disappears. The body always provides feedback. The challenge is whether you are paying attention to it. There are a few key signals that matter far more than any fixed rule or frequency guideline. One of the most important is baseline energy. Not momentary energy spikes, but overall daily consistency. A well-regulated system feels stable. You wake up with predictable energy, you maintain focus through the day, and you recover normally after rest. If sexual behavior consistently disrupts that baseline, it is worth observing. Another important signal is emotional tone. After sexual release, the nervous system should return to equilibrium. There may be relaxation, calmness, or even mild drowsiness, but the overall emotional state should remain balanced. If instead there is emotional flatness, lack of motivation, or a sense of detachment that suggests the system is being overmodulated rather than supported. A third signal is desire stability. Healthy libido is not just about frequency, it is about flexibility. It should arise naturally in appropriate contexts and not feel artificially dependent on specific patterns or triggers. When desire becomes too predictable or too conditioned, it can indicate that the reward system is becoming narrow in its responsiveness. A fourth signal, often overlooked, is behavioral control. This is not about abstinence. It is about agency, the ability to choose. If a man feels that he is choosing his behavior based on intention, then the system is functioning under conscious control. If instead the behavior feels automatic or compulsive, then it has shifted into a different category entirely, regardless of frequency. And finally, there is recovery capacity. The body should return to baseline efficiently. Sleep should restore energy. Rest should feel restorative. If there is lingering fatigue that does not resolve with normal recovery, then multiple systems may be involved, and sexual behavior may be one contributing factor among others. Now, let's address a very important psychological layer that often gets ignored in this conversation: shame and secrecy. For many men, this topic is not purely biological, it is emotional, it is shaped by cultural messaging, misinformation, silence, and sometimes guilt. And when a behavior is surrounded by shame, it becomes harder to observe objectively. That is where confusion begins. From a medical perspective, shame is not a diagnostic tool. It does not improve decision making. In fact, it often distorts it. When men feel ashamed, they are less likely to observe patterns accurately, less likely to seek guidance, and more likely to oscillate between extremes of behavior. A healthy approach removes moral labeling from biological processes. The body is not good or bad for responding in a certain way. It is simply responding. The interpretation comes later. This is why education is powerful. Because once you understand what is happening physiologically, you are no longer guessing. You are observing. Now let's bring this into a simple framework that can actually guide real-life decisions. Instead of asking, is daily ejaculation good or bad? A more useful set of questions looks like this. Is my energy stable across the day? Is my mood balanced or fluctuating without reason? Is my sexual behavior a choice or a reaction? Is my desire natural or overly dependent on habit? Am I recovering well physically and mentally? These questions shift the focus from judgment to awareness. And awareness is where control begins. If most of these answers are positive, then the behavior is likely integrated well into your physiology. If several are negative, then it is not about stopping everything. It is about adjusting variables, frequency, context, stress levels, sleep, or emotional coping strategies. Because often the issue is not the behavior itself, but what it is replacing. Sexual release is one of many regulatory tools available to the human nervous system. Others include physical exercise, meaningful social interaction, structured rest, creative activity, and emotional processing. When all of these are present, no single behavior carries excessive weight. But when some are missing, the remaining ones become overused. This is the real root of imbalance in most cases. So the goal is not restriction. The goal is distribution. Now, if we summarize everything in one clinical principle, it would be this. The healthiest sexual pattern is the one that supports stability, not dependence. It enhances life rather than compensating for it. It integrates smoothly into daily function without disrupting energy, focus, or emotional clarity. That is the standard. Not frequency, not labels, not fear, just function. And perhaps the most important message of all is this. The male body is not fragile in the way many people assume. It is adaptive, responsive, and highly resilient when supported correctly. It can handle variation, it can adjust to change, and it can maintain sexual function across decades when overall health is prioritized. So whether a man is engaging in sexual activity daily, occasionally, or somewhere in between, the real determinant of health is not the behavior alone. It is the system surrounding it. Sleep, movement, nutrition, stress regulation, emotional health, and relationships. When those are in place, sexual health tends to stabilize naturally. And when they are not, no single habit, whether increased or reduced, can fully compensate. That is the deeper truth behind this entire discussion. And once you understand that, the question shifts from how often should I to something far more useful. Is my life structured in a way that supports my best physical and mental state? Because once that is aligned, everything else, including sexual health, tends to fall into place on its own. Before we go further, it is worth acknowledging something important. When a topic like this is explored in depth, many men expect a final rule or a fixed number that tells them exactly what is normal. But biology does not work that way. There is no universal prescription for frequency that applies to every man in every stage of life. What we are really building here is not a rule book, but a framework for interpretation. So you can understand your own body instead of trying to fit into someone else's definition of normal. So in this final part, we will focus less on theory and more on integration. How everything we have discussed actually applies to daily life, decision-making, and long-term health. Because at the end of the day, the goal is not to analyze your body endlessly, but to live in a way where your body supports you quietly, consistently, and without confusion. Let us start with a concept that is often missing from conversations about male sexual health equilibrium. A healthy system is not defined by extremes. It is defined by stability. Your energy should not swing dramatically up and down based on one habit. Your mood should not feel dependent on one release mechanism. Your focus should not collapse or spike unpredictably. Instead, there should be a baseline of steadiness that allows you to function, think clearly, and engage with life without constant internal fluctuation. When sexual activity is fully integrated into a balanced lifestyle, it tends to exist in the background of health, not at the center of it. It complements sleep, supports relaxation, and fits naturally into emotional and physical rhythms. In that state, there is no obsession, no avoidance, and no confusion. It simply exists as one part of a larger system. However, when that balance is disrupted, the behavior often moves toward one of two extremes. Either it becomes too frequent and begins to dominate reward pathways, or it becomes associated with restriction, guilt, or avoidance. Both extremes create distortion, but in different ways. One leads to over-reliance, and the other leads to unnecessary suppression. From a clinical perspective, neither extreme is ideal. The healthier state is flexibility. The ability to engage in sexual activity when appropriate and disengage without distress when not needed. Flexibility is a marker of a well-regulated nervous system. Now let us bring this into something more practical. Many men ask, how do I know if my current pattern is working for me? The answer is not found in frequency charts or comparison with others. It is found in observation over time. Start with your mornings. When you wake up, do you feel restored or already depleted? Morning energy is one of the most reliable indicators of overall physiological balance. If your baseline energy is stable, it suggests that your recovery systems are functioning well. If it is inconsistent, something in your routine, whether sleep, stress, nutrition, or behavior patterns, may be influencing recovery. Next, observe mental clarity. Not productivity alone, but clarity. Can you focus without resistance? Can you shift attention smoothly between tasks? Or do you feel mentally fragmented, distracted, or internally restless? Sexual behavior, like many reward-based activities, interacts with dopamine pathways that influence attention and motivation. So changes here are worth noticing, not with judgment, but with curiosity. Another important marker is emotional neutrality. After sexual release, the ideal state is not euphoria or emptiness, but neutrality, a return to baseline. If there is emotional instability afterward, whether that is irritability, low mood, or a sense of detachment, it suggests that the nervous system may be swinging too far in one direction during stimulation and not returning smoothly afterward. Then there is physical vitality. This includes exercise tolerance, general stamina, and how quickly you recover from daily stress. The body is constantly giving feedback about systemic load. If multiple small stressors begin to feel heavier than usual, it is important to zoom out and look at overall lifestyle load, not just one habit in isolation. Now, one of the most important ideas in modern men's health is this: behavior should support identity, not override it. In other words, your habits should reinforce the kind of man you want to be. Clear, focused, energetic, emotionally stable, and grounded. If a habit consistently pulls you away from that state, even subtly, it deserves attention. Not panic, just attention. This is where self-awareness becomes more powerful than any external guideline, because no study, no expert, and no rule can observe your daily lived experience. Only you can do that. Let us also address something very practical that many men experience but rarely connect to this topic: the role of stress. Chronic stress changes everything. It alters testosterone regulation, disrupts sleep architecture, increases fatigue, and reduces emotional resilience. In a stress state, the nervous system naturally seeks quick relief mechanisms. Sexual release is one of them because it is efficient, immediate, and neurochemically powerful. This is why in high-stress periods of life, patterns may change without conscious intention. The body is simply trying to regulate itself. But the important distinction is whether this regulation is adaptive or avoidant. Adaptive regulation restores balance and allows you to function better afterward. Avoidant regulation temporarily numbs discomfort without addressing underlying causes. Understanding this difference is critical because many behaviors that appear excessive are actually compensatory responses to deeper imbalance elsewhere in the system. Now let's talk about something even more fundamental, identity and control. One of the strongest predictors of psychological well-being in men is the sense of agency, the feeling that you are in control of your actions rather than being controlled by them. This applies directly here. If a man feels that he is actively choosing his sexual behavior based on intention, context, and self-awareness, then the behavior integrates healthily into his life. If instead he feels that the behavior is reactive, automatic, or compulsive, then it begins to reduce psychological stability regardless of frequency. This is why two men can have identical habits on paper, but completely different internal experiences. One feels balanced and in control. The other feels fragmented and uncertain. The difference is not the act itself. The difference is agency. Now, bringing everything together, we can simplify the entire discussion into 3 layers. The first layer is biological response. This includes hormones, neurotransmitters, vascular changes, and reproductive function. These are predictable, measurable, and generally adaptive. The second layer is psychological patterning. This includes reward conditioning, emotional associations, stress coping mechanisms, and behavioral reinforcement. This layer is more subtle and develops over time. The third layer is lifestyle integration. This includes sleep, diet, physical activity, relationships, work, stress, and overall life structure. This is the foundation that determines how the other 2 layers express themselves. When all 3 layers are aligned, sexual health tends to feel natural, stable, and unproblematic. When they are misaligned, confusion arises. So instead of asking, is daily ejaculation healthy or unhealthy? A more accurate question is my overall system balanced enough that this behavior fits naturally without disrupting other areas of my life? Because that is what truly matters. And here is the final insight that brings everything together. The human body is not designed for perfection. It is designed for adaptation. It constantly adjusts based on input, environment, stress, recovery, and behavior. That means nothing in the system is fixed. Everything is dynamic, which is actually empowering because if something feels off, it is not permanent. It is adjustable. If energy is low, if focus is scattered, if desire feels different, these are not irreversible states. They are feedback signals. And feedback is always useful. So the goal is not to eliminate sexual behavior or to maximize it. The goal is to understand it well enough that it no longer creates confusion, guilt, or uncertainty. It simply becomes one part of a well-regulated life. A life where your body is not something you are constantly questioning, but something you understand, trust, and work with. Because ultimately, good health is not just about longevity or function. It is about clarity, the ability to live without unnecessary internal conflict, and to move through life with a stable sense of control over your own choices. And when that is in place, everything else, including sexual health, tends to fall into balance on its own. Now, in this final conclusion, we need to bring the entire discussion to its most practical and grounded point. Because at this stage, you already understand the biology, the neurochemistry, the behavioral conditioning, and the lifestyle context. But knowledge only becomes valuable when it translates into clarity in real life, when a man can sit alone with his thoughts and not feel confusion, guilt, or uncertainty about his own body. So let us end this conversation not with more complexity, but with simplicity that actually works in daily life. If you strip everything down, the entire question of daily ejaculation is not really about frequency. It has never been about frequency. It is about relationship. The relationship between a man and his own nervous system. The relationship between desire and discipline. The relationship between release and recovery. And most importantly, the relationship between stimulation and silence. Because the male body is constantly moving between two states, activation and rest, sympathetic and parasympathetic, drive and recovery. This rhythm is not accidental. It is a core design of human physiology. Every system in the body follows cycles. Heart rate rises and falls. Hormones surge and decline. Neural activity expands and settles. Even consciousness itself moves in waves of attention and rest. Sexual function is simply one expression of this universal rhythm. The problem begins when rhythm is replaced with repetition without awareness. When a cycle becomes a habit without reflection. When behavior is no longer responsive to internal signals, but driven by external cues, stress, boredom, or automatic reinforcement. That is where imbalance can quietly develop. Not because the body is failing, but because awareness has stepped out of the process. So the final question is not how often is too often. The final question is, am I still in communication with my body, or have I stopped listening? Because the body is always communicating in energy levels, in sleep quality, in morning clarity, in emotional tone, in desire patterns, in recovery speed. The signals are constant, but most men are never taught how to interpret them. Now let us make this extremely practical. If a man is trying to evaluate whether his current pattern of ejaculation is healthy for him personally, there is a simple clinical framework that is far more useful than any external rule. The first marker is stability. Not intensity, not performance, not frequency, stability. Does your energy remain predictable across days, or does it fluctuate without clear reason? A stable system does not swing dramatically based on one behavior. It remains consistent even when habits vary slightly. The second marker is clarity. Mental clarity is one of the most sensitive indicators of nervous system balance. After sexual activity, especially frequent activity, a clear system returns to focus without fog, heaviness, or mental dullness. If clarity is consistently reduced, the system may be absorbing more stimulation than it is recovering from. The third marker is emotional neutrality. This is critical and often misunderstood. The goal is not heightened emotion and not emotional suppression. The goal is neutrality, a calm baseline. If sexual release leads to emotional flattening, detachment, irritability, or restlessness, that is a signal worth paying attention to. The fourth marker is autonomy. This is perhaps the most important of all. Are you choosing your behavior consciously, or is it happening automatically? Autonomy means you can decide, pause, delay, or engage without internal conflict. Lack of autonomy means the behavior is beginning to guide the system rather than serve it. The fifth marker is integration with life. A healthy sexual pattern integrates into a larger life structure without disrupting it. Sleep remains strong. Relationships remain stable. Work focus remains intact. Physical energy remains steady. When a behavior begins to interfere with multiple domains, it stops being just a habit and becomes a system-level factor. Now, if most of these markers are stable, then daily ejaculation may not be a problem at all for that individual. The body is adaptive. It can handle a wide range of patterns when the foundation of health is strong. But if multiple markers are unstable, the solution is not extreme restriction, it is recalibration. And recalibration is a concept most men misunderstand. It does not mean elimination. It means adjustment of variables until balance returns. Sometimes that means reducing frequency temporarily. Sometimes it means improving sleep before changing anything else. Sometimes it means addressing stress, emotional load, or lifestyle structure that is driving compensatory behavior. And sometimes it simply means becoming more conscious of the pattern itself so it stops running in the background without awareness. Because awareness alone often changes behavior naturally. Now there is another layer that must be addressed honestly, especially for younger men. In the modern environment, sexual stimulation is more accessible than at any other point in human history. That means the brain is exposed to higher levels of novelty, reward, and stimulation frequency than it evolved to handle. This does not automatically create damage, but it does change baseline expectations of reward. And when reward expectations shift, motivation systems adapt accordingly. This is why some men notice changes not in physical capability, but in mental drive. Things that once felt engaging may feel less stimulating. Not because life has become less interesting, but because the reward system has been repeatedly activated in a very specific way. The solution is not fear. The solution is balance. The brain needs contrast. It needs both stimulation and stillness, both reward and delay, both activation and recovery. Without contrast, sensitivity dulls. With contrast, sensitivity restores. This is true not only for sexual health, but for every reward-based system in human biology. Now let us zoom out completely and look at the deeper message of this entire series. The real issue is never ejaculation frequency. The real issue is whether a man is living in alignment with his own physiology or slightly out of sync with it. Because when alignment is present, nothing feels forced. Energy feels natural. Sleep feels restorative. Desire feels organic. Focus feels steady. Sexual behavior fits into life without conflict. But when alignment is missing, even small habits begin to feel confusing, not because they are inherently harmful, but because the system is already under strain elsewhere. So if a man takes anything from this entire discussion, it should not be a number or a rule. It should be this principle. Your body is not trying to confuse you. It is trying to communicate with you. Fatigue is communication. Restlessness is communication. Changes in desire are communication. Changes in satisfaction are communication. Even compulsive patterns are communication. And the goal of health is not to suppress these signals, but to understand them early enough to respond intelligently. Now, let us end with a very practical perspective that brings everything together. If a man is currently wondering whether his pattern is healthy, the most useful approach is not to ask, should I stop or should I continue? The most useful approach is to observe for 2 weeks without judgment. No dramatic changes, no extremes, just observation. Energy in the morning, focus during the day, emotional tone after release, sleep quality at night, level of control over behavior, naturalness of desire. These are not abstract concepts. They are daily data points from your own biology. And after 2 weeks, patterns will usually become very clear. Not because you forced an answer, but because you finally paid attention. That is the point where real understanding begins. Because once a man learns how to read his own signals, he no longer needs external validation or fear-based rules. He develops internal calibration. And internal calibration is what allows long-term stability in health, performance, and confidence. So the final message is simple. There is nothing inherently dangerous about daily ejaculation in a healthy system. And there is nothing automatically beneficial about it either. It is not the frequency that defines the outcome. It is the context, the state of your sleep, the quality of your stress management, the strength of your relationships, the stability of your nervous system, the awareness you bring to your own behavior. These are the real determinants of outcome. And when those are aligned, sexual health becomes what it was always meant to be. Not a source of confusion, not a source of guilt, not a source of obsession, but a natural, integrated, and balanced part of being a healthy man. And perhaps that is the most important takeaway of all. You do not need to fear your body. You only need to understand it well enough to stop working against it.